Awful.
Welcome back. We have Dr. Richard Lewis joining us on the show, the sole dermatologist of our fair community. It's great to have you on the show.
Thanks for inviting me.
Yes.
It's a pleasure.
It's great to have you. You're a busy guy, clearly. We only have one dermatologist in town. Every time I've been to your office, there's many people sitting there. We have a need for more dermatologists, not only here, but around BC. We have 30% less than other provinces. 50% of dermatologists are over the age of 55, which means we're going to see lots of retirements in the next 10 years. Why is that? Why do we have a shortage and nobody else? First of all, are we getting too political right now?
No, the problem is an economical one. If you're a brand new graduate from UBC, we graduate 3 people every year. You have your diploma up on the wall, you have that big 6-figure loan hanging over your shoulder, and young kids and mortgage and car payments and so on. And you have a practice that you can establish if you want to in any part of Canada with a Canadian graduation certificate. Why would you stay in the lowest paid province if you can make 3 times as much just going to Alberta?
And that's what the numbers look like. You can make 3 times more.
That's right. And all the other provinces are way ahead of us in as far as the fee schedule is concerned. So we're losing half of our graduates to anywhere else, and we haven't got very many who are coming from other provinces who want to practice in BC because we're the lowest paid province.
Okay, so that's why we're not seeing anybody hustling forward. So you recognize that we have a shortage here. You're going to retire one day. One day.
2040, I'm not working a day past 2040.
I like
I'm
it.
just preparing you, Susan.
Yeah, I'm about 2095 myself, but yeah, I get it. Yeah, so you got 20 more years, but really, whenever you choose to retire, we will potentially be left without anyone here to take over your profession. You have decided to help ease the pressure by reaching out to nurse practitioners. Tell me a little bit about that.
Well, yes, I had an opportunity to meet a nurse practitioner at one of our continuing medical education conferences, and we happened to be chatting, and I said, so what is your background, what is your training with dermatology in your undergraduate years, in your postgraduate years? Who did you learn your dermatology from? And she said, we didn't have any. And I said, no, I mean, how did you learn your dermatology? We didn't have any dermatologists teaching us dermatology. I was blown away. I couldn't believe it. So after that, we organized through her, and she communicated with the other dozen or so nurse practitioner specialists in town to come and have their first dermatology lecture from a dermatologist. We did that last fall. We had another one in January. And the people who are learning dermatology from me are, from what they tell me, are just very, very pleased that it's now available. They've been wanting to have it. When they're looking at family practice patients, sometimes 1 out of 6 of the people they see in their office has a skin problem.
Right.
And unless they have some background information and some training to do procedures or to know how to order which investigation or how to prescribe what cream or what pill, dermatology from a dermatologist is what they need. How much time are you spending with them? Just enough for them to sort of get a feel for the various ailments that are the typical skin conditions people suffer from? That's right. Well, let me tell you about our first meeting. I told the person who was organizing it, I said, I need at least 6 people to come. I don't want to come and do a lecture for one person. Yeah. And so she organized it. We had it up at the Flavors of India. We had 12 people attend. That's awesome. So I was really impressed. It was quite nice for me to have 12 people to talk to. That was in 2017. 2018, I'm hoping to be able to do it once every month. And any nurse practitioner or any nurses of any specialty who would like to attend are invited to come for free for a dinner. And in our first one, here's what happened. We had from 6:30 to 7 kind of a get-together, get to know each other. From 7 to 8, I gave my lecture. At 8, I asked if there was any questions from the audience. At 9:30, we finished, and I said, I have to get something to eat, guys, because I haven't had anything since lunchtime. So obviously there's a need, there's a huge enthusiastic
response to my request, and we were happy to have that number come. I'm also, sorry, I was going to say, I'm also now trying to find out if there's a need and a demand for them in Whitehorse, where I also practice, and in Prince Rupert, where I like to go from time to time to see, because that's kind of an isolated area. They don't have any dermatologists there, but there may be some nurse practitioners who would be interested to learn. If you're listening from Prince Rupert or Whitehorse, give me a call.
Absolutely. Were these all nurse practitioners? Were some of them just nurses? What specialties were you dealing with?
The group we spoke to initially in this second lecture were all nurse practitioners, but I've extended the invitation to anyone, for example, foreign medical graduates who are in town here. We have quite a number of them who are waiting to be able to eventually get into the program to become a specialist. Those foreign medical graduates, I'm also going to be offering that kind of a dermatology experience too, because they don't have, they have to learn as much as they can to be able to pass the Canadian exams, and I'm here to help them if they're interested.
My first thing I would say to you is good for you for paying it forward. You're doing this free of charge. You're lending your medical expertise to others who don't know about this in the thought that they can help others. Second of all, my thought is, will the government, are you expecting a call with somebody saying you can't just do this? Or is there any concern that you could get involved in some red tape?
I dare them to tell me I can't do this. This is my choice, it's my privilege, and as a licensed certified specialist, I can teach whomever I want. I don't have any restrictions that way. There may be restrictions in other provinces, I don't know.
Okay, so that's fantastic.
Yes.
Would you like to see some of this training take place within the time that people are training to be a nurse practitioner? Shouldn't that be the next thing that happens?
Well, I did inquire about that.
Yeah.
2 or 3 years ago, I sent a note to the Dean of Nursing at the time and asked, what's the status of dermatology teaching and what do you need? And I have this, I'm available and so on. And I never got a response. Since then, the deanship has changed a couple of times, but from what I understand, not from the deans themselves, but from people who work in the nursing teaching program, that the restriction for having dermatologists is that they have too heavy a curriculum. They can't fit any more people in to do more teaching of other subjects because their current curriculum is so heavy, and I respect that.
Yes, of course you respect it, but when we come to the time where there are no dermatologists in this community, that's, I think, the time that we have to make some changes to the curriculum.
Well, I'm hoping...
That's how it seems to me.
That's right. I'm hoping, especially with the new bachelor and now master's nursing program coming to Kamloops, I'm hoping that they'll restructure it a bit, at least to have maybe even people in the later years having an opportunity to do dermatology.
Absolutely. Yeah. Our time is running short. A couple of quick things. If there's another session coming up, how can people find out about it? When is it?
If there's a nurse practitioner needing to come, willing to come, interested in coming, phone me.
Okay.
Come drop by the office. We'll be glad to have them.
Good for you.
Yes, yeah.
I know you have one thing there. There's one other question I wanted to ask you, and it slipped my mind, so go ahead with that.
Okay. Well, I heard from someone, I'm not sure, I'm not going to say from your staff, that they sometimes are interested in reading skin magazines. So I brought a skin magazine for you guys to check out, pass this on to your staff. Let's see if they like them. But anybody who's in the audience who would like to know about this skin magazine, it is actually about dermatology.
I read it cover to cover in the last...
There it is, and
yeah,
it's free. So anyone who's interested, just look at skin on Google and you'll see this medical skin magazine that's for free. Is very important for people to know about skin issues. You can get a lot of good information that helps you and your family.
That's awesome. Dr. Lewis, thank you. Those are for us in the newsroom, aren't they?
Yes.
Thank you. I'm like trying to get them from you. I remember my last question. If people want to know what nurse practitioners have had some training in this field, thanks to you, can they phone your office to get those names so that they can perhaps get that information if you're too busy, they want to go to see one of them? That's another thing. Okay, so you can phone that number. 1 in 6 have skin problems that when they go to see their doctor, that's a lot of us out there. So if you need to be referred to somebody, 374-4442. We will take a quick break. Thank you for being here.
Thank you for inviting me.
You're very welcome. You have to come back again soon.
You.
We'll be back in 2 minutes. Stay with us.